So one of the things that I've started to come around to is this whole language in chronic disease prevention around quote unquote patient compliance. And I used to throw that term around a lot when it came to how can we get greater compliance in order to get these better obesity outcomes or diabetes outcomes. But I'm starting to realize that that's not a really good approach because it places the the center of the healthcare ecosystem. It places the hospital at that center or the provider at that center. And it's really saying that everything that we're doing, the whole purpose of all of this is so that providers can be solvent, which is really not true, right? Because at the end of the day, a hospital is simply one form of business model of healthcare or healthcare delivery. And who's to say that that's the most effective or the best form? And definitely the healthcare industry as a whole, it is not an open market, right? It is a very opaque, very cartelish market in which a few individuals are controlling the entirety of all of the activities, right? It's definitely not a free market, so to speak, which kind of makes the whole objection to socialized medicine a little bit funny when, you have a cartel that's running the industry and you're basically saying anything but communism. Well, but anyway, neither here nor there. So back to compliance, right? So by saying that patients need to be compliant, we're centering the provider at the center of the healthcare ecosystem. But part of why the healthcare system is broken is that we have an incomplete value chain. The value chain should be provider, all of the supply chain that they need and rely on to provide a service to the consumer being at one end of the value chain, the provider being at the other. The problem is in our current healthcare system, there's actually the payer that's in between the healthcare consumer or the recipient and the healthcare provider. Sorry, and that alters all sorts of incentives and it misaligns the incentives of the provider and the patient. So what ends up happening is when we say we want patients to be more compliant is we're really saying that the bottom line of the provider and ergo the bottom line of the health insurer is actually the most important piece of the healthcare system, which it should not be. Obviously, health should be the most important piece. Otherwise, if we have a society in which 50% of our population is obese and 30%, 20%, 25%, whatever is diabetic, clearly clearly our healthcare system sucks, right? And so there's no point in trying to do heroics to save a healthcare system that fundamentally does not provide good health, right? That model's broken, provides bad health. So why should compliance with that system be our focus? It shouldn't be, right? It should be something that is more effective. There should be a what's in it for me for the healthcare consumer. So that's what's wrong with the concept of compliance in a healthcare perspective. So what should we change? What's this new state that we should focus on? Well, from my perspective, it should really be about what does the healthcare consumer value the most? If we understand what you, what my neighbor, what anybody who's a potential patient or a healthcare consumer, what anybody individually values, then we can understand how to properly provide healthcare services. So when it comes to lifestyle-related diseases like obesity, like diabetes, what we need to better understand is what are the emotional needs that drives people to engage in behaviors that are unhealthy in the long term. Once we identify that, once we're able to say, what is it that you value? What is it that you need emotionally? How is it that you want to spend your time and your money? And let's find a healthy way for you to get there. That is how we're going to be more effective at addressing and finding avenues for health behavior change. Not by focusing on how can you as a patient or you as a consumer behave in a way that's financially lucrative for me, the provider? Because obviously, I don't give a shit. You don't give a shit. No, patients don't give a shit about what works financially for hospitals. But by building prevention and by building care delivery models with that assumption of how you interact with patients, you're setting yourself up for failure. And then you throw in the the racism and the classism that is problematic and very much ingrained in the healthcare system, where you have whole communities due to history that have a high degree of distrust from the medical establishment. And these are the people that are disproportionately driving cost associated with chronic disease. So these are the most important people that you have to reach out to. And you're already, as a provider, starting on the back foot in these historically poor relationships that you have with these communities. And so when you go into these communities and you tell them, hey, it's better financially for me for you to do this, even if it's better financially for them, by putting and centering everything that they do around you, the provider, you're guaranteeing that people are going to switch off. They're not going to care, right? They're not going to care.